All right, are we live? Hello, everyone. It is me, Melissa D. Hall, here of Get Well with Mel. And y'all, we have an emergency episode. All right, we have an emergency. Can we say an emergency? Uh, I don't know if you all have heard. Excuse me, I'm sorry, that's my Instagram right now. Okay, all right, y'all. All right, sorry about that, you all. So we have an emergency episode, you all. We have an urgent episode. I don't know if you all have seen the news. Okay, let me know in the comments if you have seen the news in regards to President Trump's great healthcare plan that he has announced today. Let me know in the chat. And I know I have a lot of people here in the chat. I see you all coming in. Okay, I have my insurance agent community because this announcement, you all, he called insurance agents and our commissions out by name. Okay. And it also affects everyday Americans. This announcement is one of the most impactful uh, legislations, if passed by Congress, ever. Okay. To your health, to my health, to the healthcare system in general. And it's really a lot to unpack. It was a lot of claims that were made in his statement, some true, some not true, some already occurring, some will never occur. But I really wanted to give a bipartisan breakdown of this, right? Of the announcement, of his plans that he laid out. And I wanted to explain to everyone exactly how his plan would affect you, okay, regardless of what position that you are in. So, as always, make sure you have a pen and paper because I'm going to give a lot of information. There are going to be some notes to take. Make sure you go ahead and share this out. And let's go ahead and get started. Now, to go ahead and excuse me, I'm sorry, you all. Sorry about that. Have my laptop here. So, to get started, apologize here. All right. So to get started with this, you all, I felt the first thing that I should do is to go ahead and actually play his announcement for those of you all who did not see it. And as you come in, just go ahead and say hello for me because I see y'all. Okay. It's quite a few people here, but just go ahead and say hello. Let me know where you're looking in from. Let me know if you're an insurance agent, if you're just, we call a citizen, right? An independent citizen, a beneficiary, right? That's the name for it. Let me know exactly who you are. Okay. So right now I'm going to go ahead. Hello, Veronica. How you doing? Nice to see you, Mrs. Perry. As always, listen, just a reminder to everyone, I am hosting my vision board party. Okay. That is going to be happening. It's a rooftop brunch here in Raleigh, North Carolina. We're going to be going over how to get your best life in 2026, y'all. This is your year for prosperity. And I'm going to show you exactly how, whether it's you want to up-level your career, you want to lose weight, you want to make a major life decisions. There will be people in the house. I also have a person coming in. He's going to be teaching us how to use AI, okay, to reach your goals, right? To reach that vision that you put down on a paper. I'm going to be talking about, of course, 3 steps to change your life. I'm going to be talking about branding, how to use video like I'm doing right now to reach audiences and all types of things. It's going to be an amazing time. So make sure you go ahead and get your ticket. We still have a few available. Hello, Joyce. You're an agent from Atlanta. Very good. Very good. Well, listen, I see you all are here. So what I want to do right now is I want to go ahead and I want to share my screen. All right. And I want to go ahead and just play a little bit of part of what President Trump said. And we're gonna break this down, okay? So let me know y'all ready. Let's go. It's a lot of y'all here. All right, so you all see my screen, right? And let me know if you can hear the video. Let's go. Let me know.
Announce my plan to lower healthcare prices for all Americans and truly make healthcare affordable again. We're doing things that nobody's ever been able to do. We're calling it the Great Healthcare Plan.
Let me know if y'all can hear him, please.
The needs of big corporations and special interests first, our plan finally puts you first. and puts more money in your pocket. The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care. Nobody's ever heard of that before, and that's the way it is. The big insurance companies lose, and the people of our country win. This proposal locks in the massive discounts on prescription drugs that my administration.
Okay, let's talk about that. So what he just announced, okay, and this is part of a 5-minute speech that we are going to break down. Okay. Now the time is currently 6:27. By 7 p.m., I would love to be finished with this, okay? Because it's going to be a lot to digest. You're more than welcome to ask questions along the way, but by 7 p.m., I will be finished. So let's get to it. So what he announced first thing was that he was going to give the Americans money, us, right? The money directly into our pockets to purchase health insurance, right? I think that sounds like a good idea. Let me know in the comments if you think that's a good idea to give everyone a check to purchase their own health insurance. Let me know. Now, one thing I want to say is this, and I always say this is my famous line. Politicians are not actuaries. Actuaries are people who look at the numbers, right, of risk, how much an insurance company can pay out versus if they allow certain types of people in their plans. And that's how they come up with our rates. Politicians go by what feels good, what their base wants, not necessarily the science and the math behind it, which insurance is based off of. So when you start giving people money instead of them being able to go and actually get health insurance, a lot of times they don't actually get the health insurance, right? One of the things that made Obamacare so effective, okay, where it increased the rate of people being insured by probably over 30%. There are millions of people in Obamacare, okay? The reason what made it so effective was that mandate that was put in place that everybody had to have health insurance. And the reason why that was so effective is because since health insurance is all about risk, if you have too many sick people, like a whole bunch of sick people, right? That means the insurance company is paying claims out all the time. And if they're paying out claims all the time and it's nothing to balance it out, right? They're always paying, they never have anything actually staying in. Well, guess what? They go out of business, right? So that is what made it so effective, because they were able to even it out. What would possibly happen by giving people checks, whatever, however they choose to use it? More than likely, a sicker population will get these plans, not the healthier people. And what that would do then is create an unbalance, right? So it would actually make the prices higher, okay? Another thing I wanted to point out was COVID, right? We all know that we are dealing with inflation currently. And a lot of the reason why is because of those checks that were given out, those stimulus checks. That led to a lot of it. So this right here, I think in theory it sounds good, but it's going to be a mathematical disaster, and it's going to be a lot of people who like not to have health insurance, and that is really going to throw off the balance. Okay, so that is my take on that. Also, I am very curious to see how they will ration out the money, right? If it will still continue to be based on like the income and everything, how they're doing it now. That's going to be very interesting to see. Also, another thing too that we are going to see with this is that we are going to witness, if this passes Congress, a lot of insurance companies are going to go out of business. This is the start of universal health care. Okay. And one thing about universal health care is that they have to have a government option, right? And then the insurance companies, or excuse me, the government kind of decides who lives and who dies. This is the start of that, because insurance companies, without having that guaranteed money that the ACA gives them, they're not going to be able to survive, especially if they keep it where they have to insure everyone. So a lot of insurance companies will be consolidating and going out of business. And what does that mean? A government option will have to come. So anyway, let's continue on, because there is very much more to this. And let me know in the comments if you all have anything to add. Let's continue.
Administration is achieving through our most favored nation drug pricing agreement. Now, when you hear about that, for 40 years they've been trying to do it, but they never were able to do it. No other president was able to do it. I got every other country to approve it by the use of tariffs and other things. They all approved it. Nobody else got it. No other president got it. And for the most part, they didn't even try because they felt it was impossible. It'll bring down drug prices 80, 90%, in some cases, just numbers that nobody's ever heard of before. Your prescription drugs will come way, way down. And under this policy, the prices of many drugs will be slashed by 300, 400, and even 500% starting this month at the TrumpRx.gov. So instead of Americans paying the highest drug prices in the world, which we have for decades, we will now be paying the lowest cost paid by any other nation. So any other nation that's paying the lowest cost, that's what we're.
Okay, let's talk about this. Now, I have to agree here. There has definitely been a disparity in how much America is paying for medications versus other countries. And it is literally gouging the American citizen. Something has to be done. I will say that the Biden administration, part of the Inflation Reduction Act and other legislations that they have put into place, right, is that they had drugs that they negotiated with the pharmacists, the PMBs, actually called pharmacy benefit managers, to come down every year. And I understand, especially with people wanting those weight loss drugs and all the other things, the COPD, asthma medications, those things are very expensive. And Americans, we're paying thousands while other countries are paying pennies on the dollar. So I get it. I get it. My only, uh, I don't even want to say a qualm about this is that I'm curious to see how this is going to work out with the insurance companies, because we are seeing something similar happening in the Medicare space with the Inflation Reduction Act. Let me tell you what is going on. So, first things first, pharmacies, insurance companies, all of that, right? They get their medications, they negotiate with something called a pharmacy benefit manager. Okay. It is an intermediary that sells the drugs to the pharmacies, right? And they worked out prices with the drug manufacturers, et cetera. What we have seen happen is that a lot of the top insurance companies like United Healthcare, okay, Aetna, they have their own pharmacy benefit manager. So they are their own middleman, okay, negotiating with the drug companies, right? And the prices that they're actually paying are secret, okay? Now, with the Inflation Reduction Act, it made the insurance companies pay more, all right, for the prescription drugs, okay? And so that cut out their profit margin, okay, with themselves as an insurance company and also at their other entity as a pharmacy benefit manager. Okay, so basically they were selling drugs to themselves, okay, and then charging Medicare. Okay, and this has been a very big conflict of interest that the government is actually suing the insurance companies for now. Okay, you can go and check it out. Okay, and I think even I want to say Tennessee or some other state has even outlawed this because this is a very big conflict of interest. So anyway, this Inflation Reduction Act comes up, stopping this, trying to make these insurance companies pay more. So in response to this, the insurance companies actually went and started adjusting the pricing, the how much you have to pay out of pocket on the Medicare Advantage plans. So this is why this year a lot of people might see their dental go from $2,000 to $1,000 or none at all, right? Or preventative. This is why you see that maximum out of pocket go from $3,500 to $7,000. Okay, because they had to cut the price somewhere. All righty, do y'all understand? Let me know if you all are catching what I'm putting down here. And so when he talks about cutting the price and reducing it by 500% and everything, I wonder how the insurance companies, the pharmacy benefit managers, are going to make up for this. That's going to be interesting. And also that is why you see too those of you all who have prescription drug only plans, okay, that is why you see the price go up on them so much. In agents, this is part of the reason why my agent community that is watching, this is part of the reason why the plans went non-commissionable with this Inflation Reduction Act. Okay, and I'm going to get into a little bit more why it went a lot of plans went uncommissionable when we get into what he said about insurance brokers, which is coming up. All right, so Thomas Clark says, I always believe that Trump's ultimate motive is to privatize Medicare and Medicaid. Yeah, he wants to privatize it, but the thing is, when you privatize something, you have to have money, right? Somebody has to get paid for it. And he's trying to take the money out of it. It seems like the money is being taken out of the system. And I'm going to say this, we saw this happen with Obamacare. All righty. People talk about how expensive insurance is. Well, it was a lot lower before Obamacare. Insurance was lower. And literally, insurance kind of did go privatized because more insurance companies got into the game. Like Obamacare is not distributed by the government. It's distributed by private companies, and people are complaining of the price. I do not see a way where he can do this and we still have insurance, health insurance. I don't, because these companies are already kind of strapped. I don't know. Let's go on. Let's go on. Who wants to hear the rest? Let's dissect the rest of this. Oh,
Very much.
all right.
Going to pay, and the American people will get the savings. So I have to reiterate, the lowest price in the world is what you're going to pay. Before, you were paying the highest price in the world by far, and the politicians did nothing about it. So I'm asking Congress to complete the work that we've started. Next, my plan would reduce your insurance premiums by stopping government payoffs to big insurance companies and sending that money directly to the people. Obamacare was designed to make insurance companies rich. I call it the Unaffordable Care Act, with billions of dollars in taxpayer subsidies that helped their stock prices skyrocket over 1,700% as you paid more money for healthcare every single year, more and more. The premiums went higher and higher. I want to end this flagrant scam and put extra money straight into the healthcare savings account in your name, and you go out and buy your own healthcare, and you'll make a great deal. You get better healthcare for less money. That way you can choose the care that is right for your family. To further reduce insurance premiums, my plan ends the giant kickbacks to insurance brokers and corporate middlemen that only drive.
Okay. He said a lot. And I'm going to get back to this because he started talking about the insurance companies and the corporate middlemen. So he talked about insurance companies making millions and millions of dollars. Okay. So with the ACA. So I want to say this, first of all, when you hear about insurance companies making millions and millions of dollars, right? It is not from Medicare. It is not from the Affordable Care Act. It is not from that. It is from employer-based plans. Okay? Employer-based plans. That is where they're really making their money from. Okay? There is something called a medical loss ratio, also called MLR. Okay? And what that means, a medical loss ratio, is how much of premium dollars that a health insurance company takes in that they must spend on an insured. Okay. Now, ACA, Affordable Care Act, Obamacare, and Medicare both have this. And the current rate for this medical loss ratio for ACA is 80%. So that means for every $100 they take in that you pay out your premiums, they got to pay 80% of that. Okay, $80 towards care for a person to keep their status. Now that 20% that they have, that has to go to that can go to paying salaries, leases, all the other things we all know that takes a lot to run an insurance company. Okay. So that's what it goes to. So the big profits he's talking about the insurance companies making, it's not coming from ACA, especially when they have to pay 80% of the money that they get out. Okay. So I just want to let you all know insurance companies are making money from group plans, okay, and private plans, right? And ancillary plans like hospital plans stuff. They're not necessarily in HSAs, okay? They're not making money from ACA. 80% of their money has to be spent out. With Medicare, it's even more, like 85%. Okay. I just really want to put that out there. It's called a medical loss ratio. Okay. So let's go ahead and continue on because now we're going to get to what he says about insurance agents and the brokers. So let me rewind this back a little bit. All right.
Insurance premiums. My plan ends the giant kickbacks to insurance brokers and corporate middlemen that only drive up the costs, and that's what they're intended to do, drive up the cost. But we're driving down the cost. And it fully funds a long neglected part of the law known as the Cost Sharing Reduction Program. This measure alone should cut premiums on the most popular Obamacare plans. It's hard to believe there are any because it's a hated program. It's unaffordable.
What about now? Can you all hear me? All right. What's the last thing y'all heard me say? Okay. So I'll take it back from this. All right, you all. Okay. So last sound. Okay. All right, good. Y'all can hear me. Listen, I see y'all popping up. What's up, Timothy Musselwhite? What's up, Linda Riggins, Vernell Scott? What's up, Joyce? What's up, Frida Hall, Debbie Morris? I see y'all. That's right. That's right. That's right. We're getting into it tonight. Isn't that right, Mr. Musselwhite? So what I was saying to you all is, and I'll take it back from this. Insurance agents, when it comes to this ACA, right, the Affordable Care Act, Obamacare, he talked about having major kickbacks. You all, the average insurance agent only makes $10 a month from a client, okay, for the ACA. So this is a very much a volume-based business, okay? This is not a get rich quick. This is having 300 people that you have to service and keep track of, okay? And then you have to be available to these people for $10 a month. For $10 a month, you got to be available to them. You have to keep insurance on yourself. You got to pay for your license. It is a lot that goes into this, right? So it's not like we're making a whole bunch of money. It is a volume-based business. All righty. So somebody said they muted you. I'm telling the truth, right? So we had so Frida, she said The agents will still need to manage the enrollment. They will. Let me tell you all something. So in the Medicare side, right, this year they had a lot of cutbacks, plans going non-commissionable, right? The insurance companies, they said they did a study saying that they found out even if they don't pay insurance agents would still enroll people. So what did they decide to do? Just not pay us. Okay. And, this year, I don't think a lot of insurance agents were having it, and they were sending their clients directly to the insurance companies. And we got so many complaints from them, right? Because a lot of them are not licensed agents. They really don't know the plans inside and out, and the service was terrible. And so they still called us. So if they cut insurance agents out of this, it's a pity to see what will happen. A lot of bad advice will be given. They also did a study on SHIP, right? The quote unquote nonprofit, the state health insurance plan, they have volunteers. They're not licensed agents. They don't do this full time. They're just volunteers who go to a 4-hour course, okay, on insurance. And they said over like 30% of the plans they recommended were actually incorrect. Yes. And this is some person's healthcare. So, insurance agents do earn their keep, and they are needed. Debbie said we still pay the 20. So Debbie said we still pay the 20%. Well, insurance companies get 80%, right? They have to spend 80%, and the 20%, yes, you have to figure it out, because that's really even how Medicare works, right? Now, I will say, if you're on the Medicare side, I think the medical loss ratio is like 85%. So insurance companies have to pay more towards people, and that is overall. But that's where you get a supplemental plan for. Someone said, let's see. Thomas Clark, he says, Trump knows the ACA was working for Americans because it insured more Americans. Now he wants to demonize Obamacare for political reasons. He's not telling the truth. Hey, that could be. One thing I will say is that the statistics show 3 out of 4 people who are on the ACA came from a state that Trump won. Okay, so this is really beneficial to his base, the Affordable Care Act. So somebody, Vernell Scott, said a lot of people will be lost. Unfortunately, I shudder to think. So let's continue on, you all. 6:49. I think we're making good time, don't you all? And also too, just reminder, my vision board brunch, we are going to be having that. I'm pointing up top here, right? Go ahead and scan that right there. Go to melissadhall.com/events. And I can see January 24th. We do have an online option as well. We're going to help you get the life you want in 2026. If you need to make a career pivot, we're going to talk about that too and help you make that pivot. Because honestly, if you're in insurance right now, you need to pivot. It's just real. All right, let's continue on.
But it's going to cut them by an average of 10 to 15%. Next, the Great Healthcare Plan. That's the name. It's called the Great Healthcare because it's great healthcare at a lower price. Mandates unprecedented accountability and transparency from insurance companies and all healthcare providers so that special interests can no longer profiteer at your expense. As the saying goes, sunlight is the best disinfectant. That is why my plan orders all insurance companies to publish rate and coverage comparisons in very plain English. It requires insurers to publish detailed information about how much of your money they're going to be paying out in claims versus how much they're taking in profits. In other words, you will be able to watch the scam.
I just want to say this. I love price transparency, but this has already been happening. I just want to let you all know, okay? It wasn't part of the Inflation Reduction Act, but I think it was even called the Transparency Act, right? I could be wrong, but I want to say there is already standards about price transparency and making it in I forgot the term they use it, but easy to read and understand terms. So this has already been happening. I just want to let you all know, okay? I don't know if you want something deeper.
It forces them to release detailed data on how many claims are being denied and whether those denials are eventually overturned on appeal. And most importantly, it will require any hospital or insurer who accepts Medicare or Medicaid to prominently post all prices at their place of business so that you are never surprised and you can easily shop for a better deal or better care. And you're going to end up doing both. You're going to get a better deal and better care. We will have maximum price transparency and costs will come down incredibly.
Okay. Let me ask you all a question. If you go to the hospital and your foot is broken and you see that it's going to cost they show you it's going to cost you $5,000 to get your foot repaired at this hospital versus $4,500 or even $3,000 at a hospital that's 40 miles away. Where would you get your foot taken care of? I want to know. If you are in the middle of a surgery or a procedure, do you want your doctor coming to you telling you, hey, this is going to cost this much for this x-ray? But down the street, if you go to get the x-ray, right, in the middle of your broken foot, it just happened, you slip and fell, it'll cost this much. What do you want? Said better deal, but poor healthcare. This was actually already happening. Yes. The idea is good. Okay. The idea is good because these hospital systems, they try it. They really do. They get you. And you're really in a vulnerable position, right? But what is realistic? Because if my foot is broken, I've had a broken foot before, y'all. If my foot is broken, I just want it fixed. I want it fixed right then and there. I don't have time to price compare. Okay. I want it fixed right then and there. And a lot of times, I know with doctors and we've all been there. You don't even really know what is going on. They can have all the prices up for all the millions of procedures, but things change once you get behind there. And I know that people are just in pain, especially in an emergency situation, especially if you're in pain, especially look, even if you got something going on with your tooth, we can all relate to tooth pain, right? You want it done then, there, and now, right? You don't care if it's $5,000 less down the street. When it comes to emergency situations or when people are in pain, they're not price comparing. They just want it taken care of. Am I right or wrong? You all, this plan that he's speaking of, honestly, in theory, I think it makes sense. It sounds like it will work. But this, if passed in Congress, is the beginning of the end of health insurance as we know it. And I know on the Medicare side, about 60 to 70% of people were actually satisfied with their healthcare plan. This will lead to insurance companies going out of business, okay, and all of us being on Medicaid because they will not be able to stay in business. A lot of insurance companies have already pulled out. And that's another thing too. You'll see a lot of them have already pulled out of the ACA market, of the Medicare market. A lot of even hospitals, okay, have stopped receiving, Medicare funds and Medicaid patients because they do not want to deal, with the government's, oversight. And a lot of doctors, right, they have actually gone to something called concierge medicine. Have you all heard of that? Concierge medicine is where you pay a fee, a monthly fee to see a doctor, right? Some of them still take insurance, but they also have a fee attached to them, a monthly fee. And they supposed to give you more benefits, easier to see them, easier to access, but yet they don't have to deal with all the red tape of being in a traditional healthcare setting. And that's what they're doing. And a lot of insurance companies too are declining to insure people in certain areas, okay, to cut their losses. So again, this will be very interesting to see it unfold. I do know the healthcare lobby is strong. So this passed in Congress, we shall see. But Hey, anything can happen. Debbie, she said, you are right. Vernell said, while in pain and discomfort, I'm going to the nearest facility that can provide aid. Right? It can. This how people think. Honestly, I would have liked it better if he would have just did a universal healthcare option, and let's get down to it, because that's what we need. If this is it. If this is it. All right, you all. Well, look, it's 6:57. If there are no more questions, I appreciate y'all hanging with me. Make sure you share out this episode. Again, come to my vision board brunch, y'all, in Raleigh, or we're doing it online. Let's start 2026 off together. Next week, we're going to be back to our Her All Along series, and we're going to talk about how to up-level your career. Listen, let me know again. How did y'all like this episode, right? How did y'all like it? Did you find this information valuable? Will you share this with somebody? Send me an email, info@melissadhall.com. I would love to hear from you. Is there a subject you would want on here? Let me know. Let me know. Is there something you want me to cover? I appreciate you all. Y'all have a wonderful day. Share this out. Thank you. Hey, you're welcome, Caroline. You're welcome, Miss Debbie. Thank you for sharing. I appreciate y'all. Bye-bye. Very valuable. Sierra, I better see you. Sierra, thank you. Have a great evening. Yes, I love it. Thank y'all for the love. I appreciate y'all tuning in. Can't say what I really want to say about what's happening. You're so funny, Mr. Clark. I see you. You're so welcome, Timothy. I hope you got some value out of it as a agent. Nieceberry said thank you. You're welcome, y'all. You're welcome. Listen, we're gonna keep an eye out on this. Okay, and I'll be back with more too, like as this develops. All right.